So now that you've heard about Dawn's experience, let's talk about how this might apply to you. One of the things that you need to do when you're faced with the possibility of hysterectomy is to learn about the options that are available to you. This would include the types of hysterectomy for which you may be a candidate, including the possibility of LSH. Some of the things that you need to consider when you're faced with the possibility of hysterectomy is whether it's necessary to remove the ovaries and whether it's necessary to remove the cervix. When faced with hysterectomy, many women ask if they might be a good candidate for laparoscopic supracervical hysterectomy. I like to think of it in the opposite terms. I think most women would be a very good candidate for laparoscopic supracervical hysterectomy, except in the presence of certain medical conditions. For example, if you have cervical disease that might cause a problem for you in the future, or if you have precancerous or cancerous changes of the uterus or of the ovaries, that might not make LSH a good option for you. When faced with a hysterectomy, you should always ask your physician if, given your particular medical condition, if LSH is an appropriate option for you. Many physicians do not perform laparoscopic supracervical hysterectomies because of the unique skill set that it requires. Some physicians may not have heard of laparoscopic supracervical hysterectomy or not feel comfortable advising you about this. If this is the case, there are many resources available to you to help you find a physician in your area that can perform LSH and advise you on whether this is a good option for you. Resources that might be available to you in your community would include physicians who are trained in minimally invasive procedures, patients in your area who have undergone these procedures, and certainly there are wonderful educational resources on the Internet. I would urge you to use some caution when searching the Internet for sites for hysterectomy and only refer to those sites that are credible and endorsed by physicians. One resource that is available to everyone is to call the charge nurse at the surgery suite in your local hospital. These nurses work with all the physicians in your area and would be able to give you the referral to some physicians who are well trained and experienced in performing LSH. So when you're faced with the possibility of hysterectomy, remember to learn about your options. Use all the resources that are available to you to educate you about what options are available. Look for physicians who are experienced and committed to minimally invasive procedures and find out if you might be a good candidate for those procedures. The advantages to you of a minimally invasive approach would be quicker recovery, better cosmetic effect, reduced pain, and in many cases, less operative risk. This makes a minimally invasive procedure not only minimally invasive, but also minimally intrusive.